Our local healthcare workers are facing COVID-19 head-on. We spoke with a nurse at Saint Agnes Medical Center in Fresno about how the hospital is handling those patients and if she feels safe working with them. And we're now joined by Eunice Valdovinos, a nurse with Saint Agnes Medical Center in Fresno. Eunice, thank you so much for joining us. I know this is your day off, so we sure appreciate a few minutes from you. But we'd like to hear what it's like. I know you're not in the emergency room. I understand, though, you do work directly with COVID patients. So what is a typical day for you now that this pandemic has hit our area?
Every day is different because I don't know if I will be on my home unit, which used to be a surgical floor, or now it's the COVID unit, or if I'll be on a what we call a normal floor where we don't have to wear the N95s and such. But as far as patient care, it's almost the same. Maybe we're wearing more PPE, but we're still, providing the same basic nursing care, our assessments, collaborating with doctors and therapists, and maybe there's probably more phone calls to family members to try and keep them updated, especially since now we have a no visitor policy.
Which has to be pretty agonizing, I would imagine, for family members. There's so much concern about these patients. We hope that the patients that are in the care at St. Agnes are doing well. Are you seeing situations in terms of the health care of these patients where it's worse than you expected, or are they doing better than you expected?
I feel like the patients that I've seen personally, I thought it would be worse because we see other things on the news as far as New York or what went on in Italy. I was personally bracing for myself for the worst, and some people are very sick, but I had thought we would be like, like other countries, Italy or New York, and everybody's in ICU. And while we do see that, that's not every patient. So that's been a happy turn of events for us.
Yeah, we definitely want positive outcomes for everyone that does have to go to the hospital. What are the major challenges for these patients and for you and other members of the hospital staff?
Well, aside from the new information that we're learning clinically and how to treat them, with our doctors as well and our respiratory therapists, that's been, of course, a learning experience for everyone, I'm sure. But as a nurse, one-on-one with my patients, and even with the rest of the staff, it's just supporting each other and letting the patient know, because they're very anxious and this is all new to them too, of course. Just providing that support and that compassion. And some people are very anxious, and understandably so. And it's just, I feel like it's more pronounced in our COVID patients, of course.
Right, because again, yeah, there's so much that isn't known about this virus. You mentioned that when you're dealing directly with the COVID patients, you have to, have the proper PPEs, the protective equipment. Is there enough of that? I know there's been a concern about hospitals around the country that there hasn't been enough of the needed supplies. Are you feeling that you have enough, that if there's something that you need, that it is available to you?
Yes, I feel very prepared on our floors. While we are using our equipment judiciously, of course, and conserving where we can, I've always had an N95 mask always when we've needed it, and then we have shields as well and gowns when we need it. We haven't ever had a situation where I didn't have my mask, or, oh, we're out. We just, they're handed to us, and we always have it. So thank goodness.
Thank goodness. How are you feeling about support from the community? There's a whole movement, nationwide to lift these shelter-in-place, orders. People, of course, are getting antsy. How do you feel about support from the community? And is there a message that you'd like to send to the community? This is an opportunity for you to let our viewers know how you're feeling about everything.
Right. I feel in general, the community here in Fresno anyway has been very supportive, and we have our Instagram where the community's been donating masks, and people are sewing masks or they're dropping off goodies for the staff. And so I think in general here, of course, I've heard protests in other states, but I feel like here in Fresno the community is generally supportive. And I try to let my patients and families know that this too will pass, and it is hard times, but we'll accommodate where we can, and we're here to support them, and we can get together through this, get through it together.
All right, very good. We sure appreciate everything that you're doing for our community. Eunice Valdovinos, a nurse at Saint Agnes Medical Center. Take care, and we appreciate your time today.
Thank you.